The essay I am summarizing is Drug Abuse and the Brain, a Viewer's Guide. The goal of this video is to explain how stimulants affect the brain versus opioids when abused. I will specifically be speaking about cocaine and heroin. To begin, I would like to explain that the difference between stimulants and opioids is the processes they undergo when they reach the brain. For example, cocaine is a common addictive stimulant that, like many drugs, is difficult to recover from. Most think it is due to a lack of trying, but when you identify the effects of cocaine abuse on brain function, you may realize that this is not always the case. Behind the scenes, a battle between normal brain function and cravings for the next high is going on. Brain chemicals called neurotransmitters are released from one cell and sent to the cell close by to provoke the cell. Cocaine has a direct effect on the brain's production of dopamine, which is a chemical that produces pleasurable feelings and takes part in movement and memory. Common neurotransmission begins when dopamine is released from one brain cell, moves across the small space between the cells, and connects to the receptors on a brain cell close by. However, cocaine abuse hinders this process. Cocaine molecules disrupt the dopamine transporters, which causes the dopamine to collect within the space between the cells, also known as the synaptic gap. This means that dopamine continues to provoke the beginning cell and never reaches the receiving cell, which creates the feeling of euphoria or high. Heroin, however, has different processes within the brain. This affects the natural endorphins, which are hormones that help to cope with pain and stress. These endorphins connect to sensory cells, also known as receptors, and activate them. Receptors guide sensory functions within the body, such as sight, hearing, smell, taste, and feeling. Heroin molecules imitate the naturally occurring endorphins, but have intensified effects. Both cocaine and opioids, such as heroin, hit the brain so fast that people have given it a name. They call it a rush. Developing an understanding of brain function is vital to understand how medicated therapy is successful in reversing these processes. There are two types of therapy to treat these addictions: agonist and antagonist therapy. Agonist therapy, such as methadone, imitates the drug it is working to fight off, which is commonly used to treat heroin abuse. Antagonist therapy, such as naltrexone, stops the effects of the enemy drug on the body, which is most used to treat cocaine addiction. Understanding the processes that different drugs have on the brain is vital to comprehend the type of treatment necessary. The likelihood of recovery for an individual relies on the success and correct prescription of their treatment.